In the Best Possible Medications History subtab, BPMH and drug plan details can be populated with information from discharge reconciliation completed for a patient's previous inpatient visit, as long as that visit occurred in the last 6 months. By clicking the Carry Forward from Previous Visit button, information can be previewed and added to the note. It can also be edited or deleted.
Checkboxes selected in the Sources of BPMH and Drug Plan will be printed into notes. Additional details can be entered once you have checked an item off.
In the Community Pharmacist field, users can press Enter to format community pharmacy information into separate lines. As you can see above, prescription and non-prescription medications can be documented within separate tables.
Moving on to the Admission Reconciliation subtab, improved reconciliation options are available in the Admission Medications table. These include New, Same as Home, Same as Acute Care for Rehab, Adjusted, Patient Not Taking at Home, On Hold Reassess, and Discontinued. Any discrepancies and comments can be entered in the Admission Medication subtab and will be printed onto the pharmacy letter. Next is the Transfer Reconciliation subtab. Users can generate a work list of medications requiring follow-up by checking them off in the internal Transfer Reconciliation medication list. Information entered in the Discharge Reconciliation auto-populates information within the medication letter and patient medication grid. Both a prescription and discharge reconciliation note can be generated from the Discharge Reconciliation subtab. Each note pulls a unique selection of data from this subtab when the desired preview mode is selected at the time of printing. Improved discharge reconciliation options are available, including New, Started in Hospital, New, Start on Discharge, Same as Home, Adjusted, On Hold Reassess, Discontinued, and Hospital Only.
Within the Best Possible Discharge medication list, the dose, unit, route, and frequency fields must be filled out where appropriate. To generate a prescription, the unit field must be filled out for any oral medications prescribed, while frequency, EMITT or quantity, and repeat fields must be completed for all medications prescribed. Up to 2 separate prescriptions can be generated. This supports prescribers with limited sign-off authority for medications such as narcotics, and prescriptions that are filled by multiple dispensers.
Links have also been provided to easily look up limited use codes and submit exceptional access program requests. Discharge medication comments documented in this tab will appear in the discharge summary printout and the pharmacy note. Next is the medication letter subtab. Fields under the Notes heading are not mandatory. Only the fields containing information will appear in the medication letter printout. Drug coverage information can be pulled from BPMH if available. Next is the Patient Medication Grid subtab. Within the Patient Medication Grid, the instructions field must be filled out. Columns in the grid can be renamed by clicking on their title and editing the field. Add a single extra column to the grid to accommodate an additional medication time using the blue Add Column drop-down button above the grid. Columns can be rearranged by clicking and dragging the dotted edge of the column to the desired slot and removed by dragging the dotted edge out of the grid. Pharmacist and prescriber information can be pulled from the Discharge Reconciliation subtab using the appropriate button under the patient medication grid.
When printing, users can select either a vertical or horizontal grid. Most patients prefer the vertical grid. Users also have the option to include a wallet card, a list of the patient's medication allergies, and a space for patients to take notes. Users can also select text size and page size. The last medication subtab is the Key Performance Indicators, or KPI. Activity sign-off, re-sign-off, and cancellation can be completed both manually and automatically within this tab. The Mark All Completed button allows users to mark all non-reconciliation activities as complete with one click.
The Discharge Plan is a new tab that pharmacists have access to. Pre-populated follow-up instructions can be selected and further modified if needed. According to UHN policy, the most responsible provider is responsible for the review and sign-off of a patient's discharge summary.